Good afternoon. This is Leigh Anne Burns, and I am a consulting nutritionist with over 25 years of experience with working with patients with neuroendocrine tumors and their nutritional needs. Today, I have the privilege of presenting today information related to nutrition and supplements. Today, I hope to be able to give you a basic overview of what nutrition supplements are and what we mean by nutrition supplements. Go through some of the current research that we do have available to us and exciting information related to neuroendocrine tumors, cancer patients, and nutrition supplements. And also, during this time, we'll also discuss some of the standard uses and how to work with monitoring nutrition supplement usage. So, what do we mean by nutritional supplements? There's three basic types today that I put these into categories. We're going to start with oral nutrition supplements. These are very important, and they contain 100% of a patient's nutritional needs to be considered an oral nutritional supplement. It has to be complete. We'll talk about that. We're going to talk a little bit about vitamins and minerals. This is usually an area that people are very interested in, and also cover basic, what's now considered biological-based complementary alternative medicine, which is also used widely among cancer patients and neuroendocrine tumor patients as well. So what is oral nutrition supplements? This is a commercial product that can come in many forms. Liquid form and powder forms are the most common. They must have complete macronutrients and micronutrients within the product. And what it's used for is to increase the oral intake overall for patient that may need it. It contains vitamins and minerals as well as trace elements. And these are monitored to assure that its labels match what's contained. It is set up so that it's nutritionally balanced for 1,500 calorie needs as their standard. These can become in different areas. Sometimes they are meal replacements, and they can also vary according to the amount of calories and the calorie density that they contain. They also can have specialty needs, such as uses in diabetics. Patients with COPD, kidney disease, liver disease often have to have a specialty product, which will have differences in the components of the protein types, carbohydrate types, and the fat types that are contained in these products. We use them in patients that have high stress levels or high protein needs as well. It also has their specialty products in the same area of complete oral nutrition supplements that's very helpful in neuroendocrine tumors because of their help with malabsorption and GI problems. These are usually partially elemental or partially broken down, we speak about. And the research that we have available at this time shows that this is achieved with the use of oral nutritional supplements widely. The research is pretty good in those areas. There's also some research that has used specific ingredients such as the fish oil to show that it reduced the inflammatory effect overall. And sometimes neuroendocrine patients do not do well with just the standard formulas that we use in other patients. They actually need a specialty product or something that may even have an MCT oil for their fat sources for patients with GI disturbances such as diarrhea and fat malabsorption. And then we have products that are not really nutritionally complete, but they're very useful. These can be protein powders. Often they're amino acids. We also have products that's being researched heavily, and I'm real excited about, and it has shown some improvement in overall care. It actually is also used in oncology overall and accepted and discussed even in the oncology clinical journal. Next, we can talk about the biologically based complementary medicines, and this includes some of the vitamins as well. I had vitamins in a different category, but this really overall was looked at and to include vitamins and minerals. What we found in some recent studies showed that 60% overall use, 42% used two or more, and it's most common among women. It has been associated with some dietary intake and improvement in the ECOG performance. So there are some encouragements with this. The problem is with a study where it was self-reported, and they're not well defined about what was a vitamin, So these only need to be used under guidance of a primary care physician or provider, and really your oncologist. It's not recommended during chemotherapy as far as the alternative medicines that have not been outside of vitamins and minerals that have been used, prescribed by your physicians or discussed with your physicians and as part of your care plan. We do know that some of these herbal treatments do cause some interference during chemotherapies, and one example of these in the neuroendocrine area is Afinitor and St. John wort. In the study that I discussed a minute ago, you can see here a little bit of what was found as far as vitamins. But we talked a little bit about the overall CAM at 61%, 52% take more than two forms. In this study, vitamin and mineral overall use was 47%. Most often it was calcium and vitamin D, and the fat-soluble vitamins are something that we are concerned with. Some of the non-vitamin mineral overall use was 33%, and these can vary between fish oil, which was the most popular overall, and then all the way down from herbs, ginseng, garlic, and actually probiotics was included in this as well, which I think was interesting. The vitamins is very common among cancer patients to have vitamin deficiencies. Fat-soluble vitamin deficiencies have been found in neuroendocrine tumor patients. We know and often hear about niacin. Fat-soluble vitamins are stored in the body, so we have more of a concern with overuse and toxicities in this group, even though we see a high amount of fat-soluble vitamin deficiencies. And this has been studied quite well over the years with oncology patients and these levels of vitamin D. All vitamins need to be actually checked by test results to identify that they have deficiencies and not be used without guidance and without monitoring, because we have interferences sometimes with medications, and actually the toxicities in fat-soluble vitamins can be detrimental. So we want to make sure we have a good plan. So the most common mineral that's used is calcium. We also see use of phosphorus because of bone health concerns. Potassium in some areas of diarrhea can be a concern, both highs, but we don't want to get lows. We want to never use potassium without monitoring due to concerns of toxicities. High levels can cause heart attacks, actually. Magnesiums in high amounts can cause diarrhea as well. So we want to monitor all these, make sure that we know what your levels are before use, and make sure that we always use control and monitoring, and as part of your care plan. In summary, nutritional supports are used widely among oncology patients. Oral nutritional supplements are found to increase intakes of nutrients overall and are beneficial, that we feel comfortable with research to continue this and to learn more. But at this point, we want to encourage specialty use of nutritional supplements so that they meet the needs of neuroendocrine tumors. And remember, it's not all of them are going to meet the needs if you have malabsorption. So levels should be monitored and adjusted on a regular basis. Some of these nutrients actually can increase the performance status. We want to monitor this very well. We do have concerns always with interferences and treatments and use of CAM. And in conclusion, it's always important that we have a conversation between patients and providers when we're using nutrition supplements, whether it be oral nutritional supplements that are controlled, and we know what's in these products. We know that there's a big deficit in some of the information in some of the herbal areas. So even things that can be beneficial can be problematic when is taken in larger amounts than what is recommended. So a basic understanding and use of nutrition supplements are very helpful for both providers and patients, and remembering that it's not a one-size-fits-all. And we also want to provide reliable sources of information related to nutritional supplements and avoid the use without medical advice. Follow the research, be aware of that we're in a time when more research is coming out in nutrition and NETs all the time. I hope to be a part of this as my team internationally, which is going to give more advice and more exact advice that may answer some more of your questions in this area. And again, make sure that we include everything as a medical team and work together as practitioners and with our patients, and follow standards of practice is very important in the areas of oncology overall. I want to thank you for having me today. And you can refer any questions to Cancer Nutrition Care if you would like to get in touch with me later. And I hope this was beneficial. Thank you.